Welcome to MVB Life Empowerment Sessions. So today we have a special guest speaker for you. I would like for her to introduce herself. Do you mind telling us who you are and a little bit about yourself?
Yes, hi everybody. My name is Octavia. I currently work at the Department of Education as a certified school counselor. And then also on the side, I also am a therapist for social work counseling services in Astoria, Queens.
Awesome, power packed guest. So I'm pretty sure you're going to learn a lot. And then if you have any questions, please make sure you leave comments, your questions below, and we'll try our best to get back to you on another segment with answers on that. So our topic today, we are going to be talking about mental health. From your point of view, what would you say is mental health? How do you diagnose it, should I say?
Yeah, I
Or
mean,
recognize it, should I say?
I mean, mental health is a broad statement, right? There's different components that go along with it, right? People see it as some depression, anxiety, and things like that. But what we do, we pretty much look at the person as a whole. As we look at the person as a whole, we tend to see there's different stressors that involve them to make it disruptive for them in their mental health and their well being.
Right, okay. So basically, you're saying you look at the overall outlook of an individual. You're looking at physical, emotional components, character, right? And mood and behaviors
Yes.
from the little that I was reading. What would be major triggers in a person for them to say they're not feeling like themselves? Can you give us like some examples, things to look out for?
Yeah, it can be either like family dynamics. If something's going on in the family that's very alarming to them and stressful, that they can't function in their daily life. It can also be bullying, right? Like people sometimes have like bullying in their life, right? And then also they become bully people that bully others because of what happened to them, right? That basically is an influence in their low self-esteem. It can be a variety of different things. Whereas depression, it could be seasonal, right? Like depending on the weather, depending on the season, it can basically impact the person. And then also like drug usage, right? Like that's a lot that's happening. It's a big endemic, I would say, of it. And that can definitely mess up the person well-being as before because they're not mentally there, right? There's different components that when they are taking drugs can definitely mess them up. So
Right,
yeah.
because their, I think, thinking and reasoning abilities becomes altered, right, because of the substances, drugs, pills, whatever form it is. So one thing I'm realizing is that before a person starts taking drugs, um, there is a trigger, like there's something going on in their life. Like you're saying, it could be seasonal, which is definitely new for me. I've never even heard of that. So there are people, you're basically saying that there are people that have seasons or times. It's just for that segment, depending on whatever is going on in their life, right? So when they have those unsettling thoughts, which in turn leads to depression and anxiety. And like you said, factors include family, society, friends, and things that are going on, maybe at school, at work, relationships, and the nature, right?
Yeah.
So before they start taking drugs, you can see these telltale signs of a person like, oh, they are really not themselves, right?
Yeah.
A lot of times I think we just attack people to say, oh, you're taking drugs, what's wrong with you, and that kind of thing. How do we reach out to people that are already on taking drugs? Because
Yeah.
right now they're trying to forget, I guess.
Yeah, some people say that they're trying to numb the pain based off what's happening in their current situation. Dealing with people with drug usage, or I would say substance users, is definitely hard. It's a process, and in counseling we use something called motivational interviewing, and that's the process of change. Right? There's the pre-contemplation, contemplation, and then preparation. So it's different stages to deal with that person because a lot comes along with it. And when you as a counselor dealing with someone who's dealing with drugs, it's definitely a lot that could be a burden for you. Yeah, because it's like you think that they're going in the right direction, and then they end up not doing what they're
They
supposed
snap.
to. Yeah. So it's like you have to be very patient, like anything else, right? You have to be patient and know that it takes time, and people have their own way of dealing with certain situations.
So in that instance, like you were saying, contemplation. Can you break it down a little bit for
Yeah.
people like me who really wouldn't know what that is?
Yeah, sure. So pre-contemplation is like you have the thought, but you're not necessarily want to change yet, right? Like you want to do something, but you just don't have your mind set up of actually acting on it, right? And then now we have the contemplation where, okay, I know this is a problem. Now I'm going to try to fix it. And then you have like the preparation where you know that you have the
taking
problem and you're
steps.
taking steps.
Oh, okay. So, guys, pre-contemplation is the first stage. Second, contemplation, and then the third one is preparation.
Yep. And then
right?
action.
I'm learning today, guys. I'm learning. I'm a good student.
Yeah.
I'm gonna write this down.
Yeah.
So, okay. So it's fair to say that just because a person says they want to change, does not necessarily mean they want to change.
Yeah.
Sometimes they might just be saying it
Yeah, or
to
just
calm everybody down.
yeah, or sometimes it's just hard, right? Like it's hard for the person to make that change because of their circumstance, or that they don't believe that they can do it. And I think that's why they go to someone to try to help them find those things that they have within themselves.
Okay. So, what would you say to families that have people that are, you know, mentally unstable? Maybe they are okay, but you just know that they are drowning. They are going in a deeper rabbit hole of some sort. Because there are signs. You can see it before it completely, gets out of hand. What would be your advice to parents like that, spouses like that, or friends? Yeah. Because sometimes you have friends that are like that. Oh,
Yeah.
what would you suggest? How should they deal with this?
Yeah, I think that you just have to be patient and know that everybody has their time of wanting to change, and just be there for them as a support system. The biggest thing in counseling is making sure that you have a support system, because without a support system, you're going to be in the deeper rabbit hole, right? Yeah. So it's better to have a support system, coping skills, right? Like different modalities that's in place that we have, right? We have person-centered therapy that focuses on the person. We have solution focus, where you focus on the not necessarily the problem, but the person in the problem. And then we have, as essential, like, what is your purpose? Like, what is out there for you that you feel like you need to make the change? How are you going to make the change? So there's different things into place based off the client, right? Like everybody's different. Not everything's going to work for them. So you just have to see what best fit their niche.
So, being that you, as a therapist or counselor, you have to take in this information, and I believe it's very overwhelming. How do you cope?
Yeah.
What is the mechanisms that you use? Because I can't imagine you having to take in all this garbage, right? That we, let's say if I was your client, I'm pretty much coming to dump everything on you. And you're trying to figure out a way to fix me, right? How do you cope? Because at the end of the day, even though the person goes, you are going to carry all that stuff with you home to your loved ones. How do you deal?
So I would say two things. Definitely putting God first in all things that I do. Without doing anything that I'm doing, I think that I have to give all glory to God, because I feel like without Him, I would not be able to be strong to do anything that I'm doing. Secondly, is detaching yourself from the situation, not getting so emotionally attached to people, because when you do that, you begin to bring stuff home, right? We do that all the time at a workplace, right? So we have to be careful on leaving work where it's at and focus on where you at in your home, because that could be a destruction in your home as well.
Right. So just taking time to center yourself, detach from the situation before you go home. I remember this older lady. She used to say to me, "Work can be very overwhelming. So if you think you're not in the right place before you get home," she had children. She said sometimes she would park the car, take a moment to just meditate and pray, make sure she's in the right mind, so that she would not carry that energy that she got from work or from whatever situation was ailing her, because it's hard. Like, she works in the medical industry, where you're seeing people pass away and die, that can, like, really torment you sometimes. And then you have to go home, you have to be loving to your children, your husband, your kids. So she was saying the most important thing is to dissociate yourself, like you said. Take time. Self-care, I think, is very important, right?
Yes, that's a big thing.
It's a big thing. And I think that also goes to if you're struggling with anything,
Yes.
that you have to take time to take care of yourself.
Because I always say, like, you have to take care of yourself before you can take care of anyone else. So it's better to take care of yourself, and then all other things will be added if you just put yourself first, and make sure that, it's tough. It is tough. It's a hard field. It's a burnout field. So you want to make sure that you are finding ways to keep yourself grounded and able to make wonders in a person's life.
Totally. And like we always say here on MVV Life Empowerment Sessions, we discuss life topics, but the most important thing is that we center our conversations on our source of strength, which is God.
Amen.
We believe in Jesus Christ. So
Yes.
we want to make sure that we are coming from a wholesome point of view. We're not giving you just what we feel, but we know that through prayer, through understanding and caring for each other, that you'll be able to thrive and live a better and wholesome life. So before I let you go, maybe there might be somebody out there that's struggling mentally and might be saying, I need help. What should they do? Are there resources or places they can go to look for the help?
Yeah, definitely. That's why I'm
Please
here.
help.
So definitely, I would say to make sure that there's a text that you can use if you're anybody who wants to harm themselves or they know anyone who wants to harm themselves. It's called NYC 988 is the suicide hotline. Then we have the NYC Talk Space for teens if they want to talk to a live person, if they're going through anything or facing any type of crisis, and they're there for 24/7.
24/7. And I also know you mentioned that as a side hustle, you do therapy sessions. If somebody is interested in having you as, their counselor and assistant in their situation, how would they be able to reach you?
Yeah, so I don't think you can necessarily see me. My schedule is booked, but
Your team.
yeah, it's my team.
Yes.
It's in Astoria, Queens. It's called Social Work Counseling Service. The head person there is Sherry Livin. She's a sweetheart. She's the owner there. It's a nonprofit organization that's there in the community of Astoria, Queens. We do hybrid, we do online, and we also do in person.
Oh, that's wonderful. Guys, you could get counseling online. That is wonderful. You don't even have to leave your house. So there are so many resources. I will collect that information from Ms. Octavia Jackson and put it in the comments. So if you do need help, you can always reach out to those facilities and find out how best you can be helped. And also, you said New York City, NYC 988, right?
Yep, for suicide.
Which is suicide hotline. Okay. So there are resources out there to help you. You're not stuck in your situation. Look for help. There are rehab centers if you're a drug addict that you can call. In every county, they do have that. So just, Google it. You'll be able to find access, get the help that you need, and your life will forever be changed in a